Hi guys, doing another reflection for you for my rotation, my third rotation. I felt that this rotation was conducive to my learning. I thought that I really got a lot out of my rotation. Things that I was focusing on that rotation was definitely my patient care, just doing ongoing and new patient teachings. So I felt like I got involved with those a lot. A lot of the new patient teachings we did have were breast, which I was a little disappointed because I needed to get quite a few different new patient education sessions for competency. But doing more of those gave me a little bit more practice with it, allowed me to get a little bit more comfortable with the actual teaching and sort of diversify my teaching practice to be able to tailor it to the patient and not necessarily recite something from beginning to end. I need to work on a little bit more of a conversation aspect of it as opposed to just putting across all the information that I need to give to the patient. So being able to go through that and sort of have different scenarios where patients ask different questions, or being able to answer questions a little bit differently, or to be able to continue along my teaching with it being broken up in between with conversation with the patients. So trying to find a flow and be able to still get across all the information I need to, but allow the patient to feel like I'm a person and not necessarily just spitting out information for them, but more or less letting them feel like they're part of the interaction and not just listening. So that definitely helped me to do that for sure. I mean, a lot of the ones in the past have been a little bit more of me just regurgitating information and not really listening to the patient as much as I would have liked to. So having taken those steps and being able to have those experiences to manipulate or to hone my practice to be able to tailor things was really good for me in that sense. Other things that I was focusing on that rotation was skin electron setups, because I found that from my previous rotation I did a lot of breast electrons, and I just felt like I needed to do more electrons for me to feel confident in it with involving skin cancers. So with that particular aspect in mind, I was able to have a wide variety of different electron patients on the unit, and took full advantage of those from day one and said, this is what I need to do. I need to start doing these things, and I need you to understand that this is what I'm focusing on for this rotation. And the other part was being able to clinically reason with my fellow partners and actively participate as a partner, not necessarily be overshadowed as a student. So in that case, it was just me trying to become more confident with myself and my abilities and be sure that what I'm doing is correct, and be able to reason with other therapists why I want to do what I want to do, and sort of not shy away from anything. And that's something that I've been really trying to get over for a long time. So having the opportunity for me to sort of get out of my comfort zone and really push my practice and be able to make those decisions is something that I'm very grateful for. And the therapists on my unit definitely pushed me to question things a lot more. And I mean, they tested my skills and asked me questions, and by having those sorts of questions asked of me, I was able to critically think a little bit more about the situation and really pull my knowledge into it and apply it, which I am very grateful for. I'm happy that my therapists have been pushing me to reason these things and be able to have those conversations. And I'm happy that they've managed to really forced me to think about things a little bit differently. So I feel with this rotation I've managed to sort of hone my practice a little bit more towards what I want it to be. I increased my efficiency with different setups and allowed myself to um, try and do different things in particular setups or rethink things, or with some situations that don't go well, what are some ways that I can fix it. In some instances, if there's imaging that needs to be done, or if one image needs to be repeated, or just looking at patients' charts and knowing when things need to be done, and to be able to assess that and make those choices to say, yeah, you know what, this hasn't gone as well as I want it to, and I'd like to image on this, or to reassure yourself that what you've set up is where it needs to be. I mean, overall, I found that this rotation has helped me to really define my practice, and I'm happy to say I'm on the home stretch, and really grateful for the opportunities that my therapist has given me.